Good morning. Good morning. Welcome to our Tuesday coffee chat. Happy to see a lot of folks here this morning, and there's maybe more watching along or listening along at home. I do not have a presentation, but the lovely blue screen is certainly lovely. Let's begin with some appreciation, shall we? So over the past few weeks, we've had some wonderful events, community events, and I'd like to thank Andrea Skeens for the beautiful memorial service last week. It was well attended. It was a little bit different than we've had in the past, but very meaningful, very touching. So she and all the volunteers who helped put that together, we definitely want to thank. We also want to thank Lori and all the resident volunteers and our staff volunteers for putting on the Christmas market on Friday. Also a huge success despite the fact that we had a gas leak out on Lee Davis, and it did divert some traffic, but hopefully did not deter any shoppers. So thank you, Lori, for that. And also Hallie, who put on a wonderful Veterans Day breakfast yesterday, and all the volunteers who helped with that. So happy belated Veterans Day to all. You're always in our hearts and mind every day, not just once a year. With that, we're going to start with some of our announcements this morning, and I'll invite the folks from At Home Harmony to come up first and share what they have to share with you this morning. Our mic's a little loose. Yep, you guys are up. There we go. It's all you.
Okay. Hello, Justin. Okay. Good morning, everyone. I'm Rachel. I am the nurse manager with At Home Harmony, and I have over here our clinical staff in the clinic, Hannah and Luann, so some of you might recognize them. And I'm here just today to share about our services. This might be new to some of you. Some of you might already be well established in the clinic, and so Hannah and Luann might recognize you. But who we are, At Home Harmony is an in-home medical provider, and we have also a clinic at Covenant Woods, so very unique for our model, but it provides a great service to you all for medical needs. We have primary care providers in the clinic. It will now be Scott Owens, a nurse practitioner, and Sonia Allman, nurse practitioner. And what we do is we can be your primary care provider if that's what you need, and we would love to be that for you. We also add what we consider complement care. If you have a primary care provider that you love and you don't want to leave them, but it's getting a little bit more difficult to get out and go see them, we can be your supplement care. Okay. Now, what we ask for you all to come in, if you are interested in that, either one, primary care or supplement care, come in. You'll do a new patient visit. We'll get you established so that we get a picture of your health. We will introduce you to some other ancillary services that are very, very important. I'm going to mention them right now: chronic care management and remote patient monitoring. And from there, you and our providers will figure out what works best for you on a cadence of coming back in to stay established with us. Now, if you have a primary care provider that you want to keep, but you also want to be established with us, we do ask that you come in. Typically, it's about twice a year, maybe more depending on the picture of your health, just so that we have a pulse on what's going on. So that when you come in for your acute needs, which we do accommodate, so COVID symptoms, flu symptoms, wounds, urinary tract symptoms, all of that stuff, we know what's going on. We have the most up-to-date health information. So it really helps you get the best care that you need. It allows you to stay here at Covenant Woods and get that elevated medical care that you may need and want. And so I will kind of go to speak to a couple of the other ancillary services. You heard me speak about chronic care management and remote patient monitoring. I will start with what I call CCM. CCM is a program where you consent to. It is covered by Medicare, and it allows our clinical staff to have a pulse on you in between the appointments. Okay, so a lot of times what we see just in general with our practice, we have, well, let's take a step back, bigger picture of our healthcare world, right? Typically, you get an appointment with a PCP, you go in, you might have 15 minutes with your provider, and then you don't see them again for 3 to 6 months. In those 3 to 6 months, you can have a number of different health needs. You might have I say you, the royal you, but there could be a fall, there could be a UTI, there could be a hospitalization. All these events happen. You go back to your primary care provider and have another 15-minute conversation about everything that happened. Chronic care management allows our staff to be essentially, I say, on the offense, calling you, checking in on you, seeing what things have changed. Hopefully everything is stable. And then, of course, if you have acute needs that come up, you can call us, and we can be working for you without having to schedule an appointment. So it's a really great service. It's not something tangible, but it is a great service to patients so that they can really get that holistic care. Remote patient monitoring, we do have actual devices that we can supply you. We have blood pressure monitor, scale, and glucometers. And this allows us to get real-time data sent to us. It does not replace EMS or 911. It's rather a way for us to get up-to-date trends for your health and make medication changes. So the other two services that I want to point out is there's three additional. Personal care. We do have a personal care service where you can have care aides come into your home and care for you. This is the only out-of-pocket expense that service that we provide. So unless you have long-term care insurance, that is an out-of-pocket expense. We also have pharmacy. Our pharmacy does delivery system and pill packs. This allows you to be a little bit more consistent with medication management, and we come to you. We deliver on a 14-day or 28-day cycle. And the final service that we provided is new, and it is new to Medicare, so new to everyone, is the GUIDE program. This is a dementia care program. It allows you to get all of the things that I just spoke about, and it also allows you to get 80 hours in vouchers for personal care. So you can get care aides in your home. We also run certain programs for caregiver support and ongoing education. So that is a little bit of a snapshot of what we do. If you're not already enrolled, we encourage you to come to the clinic. It's right around the corner, and meet Hannah and Luann. They'd be happy to give you more information. And that's it for me. Can I take any questions?
I think it's a great service, and I think we should. I think this is a potentially great service for us. And as a matter of fact, my appointment is right after this meeting. I have a 9 o'clock appointment with Scott. But I think we should all take advantage of it so that we keep you here for the long run. Just a comment.
Oh. Amen. I like that. I completely agree. We y'all's support means obviously everything. So we hope that you enjoy the services. But if you have feedback, we're happy to hear it. But thank you for that comment. I appreciate it. Any other questions on the services or comments? Okay. All right, well, I will hand it back off. And again, Hannah and Luann would be happy to talk to you and answer any questions anytime you want, normal business hours, okay?
Thank you very much. I agree. It's a wonderful service that we have. So please do take advantage. Let me ask any members of my team back there if they have anything to share today. Megan? All right.
Good morning. Hopefully everyone took the annual survey. If you forgot and it's still sitting on your kitchen table, you can still get it in this week. We're not closing it just because a lot of people put their survey through the mail, so we're going to close it at the end of the week to make sure that we get all of the surveys in. So again, if you have not taken that annual survey that I sent out a couple weeks ago, we can sneak you in, so please take it. Again, it will close though probably by Sunday of this week. Other thing is I've been hearing a lot of buzz about scams. So has anyone received any fraudulent calls, emails, mail? Yes, yes. I'm surprised not everyone raised their hand twice because I get most of my phone calls are not by any friends, it is by scammers. I just wanted you all, or just remind everyone to stay vigilant. If you receive something through the mail that you did not, it's not an organization or a business you do work with, do not reply, do not answer, don't fall for the hype. Even recently, someone got a house warranty, I think. We've had car warranties, lots of other stuff. Some mimic our organizations as well that you might do business with. So just be mindful, and when in doubt, call the organization number that you have. So if you have a bill, look for that bill and call that number that's on the bill. Don't call on a solicitation flyer. I am probably going to do a little bit more education on AI. I attended a couple conferences recently, one with the Attorney General's Office for the State Triad, as well as the Leading Age National Conference. Scammers are getting very sophisticated. The AI technology that also helps us with many, or that we hope that will help us in our homes, is also working against us because scammers are using them. So one thing I learned about is that you know how sometimes you've gotten a call from, say, I don't know, Hanover Sheriff's Office, or I don't know, a legit looking business, you pick it up and it's not them. That's called spoofing. So they pretend, they mimic they're somebody else. Well, now the new thing is that with AI technology, your voicemail with your voice on it, they can take that and use it just by you saying, "Hi, please leave a message." They can take that and create a whole robotic voice to call somebody. So I say that because the grandparent scheme is on a new level. So it is not the, frail old person where they're calling and, you feel like, I don't know, like sometimes I don't like how the media portrays that grandparent scheme, but it's getting very sophisticated where people or scammers are learning, because you can just Google and find out who's related to you. They'll call numbers, they'll get voicemails, and they'll try to figure out the relation, and they will use that. So what sounds like your grandson or your daughter could not be them. So if it sounds weird, just say, "Let me call you right back," and then call back the number that you know. It's sad to say this message, because I know you grew up trusting and believing in a lot of things, but in this day and age, we have to be cautious. So if you didn't seek it out, always question it. If you need me to look it over, just give me a call. I'm happy to look it over. I can also contact the Hanover Sheriff's Office. They filter through their crime prevention program a lot of the local scams, but it's happening worldwide. It's happening everywhere. There's not really a way to stop it other than to educate you all to not give any money or fall for it, and they're getting trickier. So I even sometimes have to question some things that I get because it looks legit. So is there any questions on that I can try to address? Yes.
Should we redo our answering service? Should we redo our message so we're not using our voice?
So, yeah, you could. This is something new I heard, so I imagine it is not widely done yet, but I think we'll see it soon. You can get we can get a lot of stuff on Amazon to do, like for kids, to do voice changing, recordings. So I can only imagine what a 16-year-old kid can do with a computer and some IT knowledge to be able to dupe a voice. So if you're able to, you may want to use a, like the general recording that I think you can get with most phones. I'm happy to look into it more if you all have specific questions and how to do that. So, anything else? Okay, thank you.
Good morning, Carrie Davis, Administrator. Just wanted to share a couple of updates since our last town hall, and knowing that not everyone may have made the council meeting earlier this month. So I wanted to let everyone know that the Medicare 5-star numbers were updated the end of October. We do have an overall rating of 4 stars. Our health inspection and staffing are still at 4 stars each. Our quality measures are at 2-star. That does break down into short stay at 3-star and long stay still at 1-star while we go through this process. When you do get the council minutes and the reports from the November meeting, you will note that the report that I provide has changed a little bit. We put some verbiage in that announcement for the change, going back to a percentage basis. But do note that our percentages for that month or for that calendar month and will not directly reflect what is posted on the Medicare 5-star. But we continue to work on that to make improvements so it's easier to understand. A couple other quick updates, just so that you are aware. The CDC has recommended that everyone 65 and older, or those that have other diagnoses and complications, receive a second or a booster COVID 2024-2025 vaccine. Shavante is making arrangements for a clinic to be available in April. So for those of you who have recently participated in our clinic, that will schedule appropriately for you to receive that at that time. The other information, just to let you know, as a reminder, thank you to At Home Harmony for being here today, but we do have a couple of Alzheimer's dementia-related programs this month. One Lori has helped put together with the Alzheimer's Association, and then there is another program with our At Home Harmony group specifically about GUIDE, if you have any questions about those. So just a couple little updates. Were there any questions? All right, thank you.
Well, that concludes our announcements. We can certainly open the floor to questions if you have any for me or for the team back there. Hearing none. Did you have one? Mr. Haas?
When are we going to stop being locked out from various places?
Oh, that's a good question. Tim was going to provide an update for everyone as he did at council. What I can say is that the server, the internet, is interfering with the door progress. And for us to upload and really rectify that with the new program and platform that we have. Tomorrow, there's supposed to be a fix that Viacom is going to do on our system that is supposed to help with the chatter, as it's called, to allow us to continue to move forward with that door project. So fingers crossed. It's a behind-the-scenes sort of issue. There's a lot of chatter on the internet that's happening on our server that is causing the system to just randomly drop out doors or fobs. So we apologize for that, but that should be rectified this week.
We going to be able to call you on our cell phone? I'm at door number 37. Let me in.
Sure, I can come do that. You saw me at the gate last week. I'm happy to come run and let you in no matter where I am.
This morning I forgot where I left my car because we couldn't get in from the garage.
I may not be able to help you with that, but I'm happy to help search with you. And it looks like Megan has something to add.
So I can't speak on the hardware. There's a couple things happening that I'm aware of. One, we are converting. That was a couple weeks ago. We're still in the process, but this, like as Tom said, this doesn't have to do with the conversion. So there are some things going on within the system that are causing doors to randomly go offline. However, I still would like you to report them to the front desk because Haley and I are trying to keep track, as well as Dwayne and Tim. If we're able to fix it, we will try, because we were able to do that last week with the vendors who was on site. He did something and then we were able to download and you were able to get in. It doesn't always work, but we'll try still. I'm on that front desk distribution email as well as Haley. So just send it there and we'll figure it out from there. What was the other thing? Wear your Sarah pendants. So if you go out and you can't get in somewhere, so you don't have to walk around to a main door, please wear your Sarah pendant. I would consider that if it's nighttime, it's cold, and it's dark, that's an emergency. Please hit your pendant and spread that to your friends. I'm hoping this gets solved. It's random where it happens and when and how many people it affects, but still do let us know so we can try to help it. And as Tom said, we hope it will be rectified tomorrow. So thank you for your patience. Don't lose faith in this system. We just had a lot of things going on behind the scenes. That was not really the door systems issue. There's Wi-Fi. There's a lot of things going on. So, all right. Any other questions? All right. Thank you.
Is there any way we can get different passwords other than those symbols? I mean,
The
my children
hieroglyphics that
were-
we're
my-
using, you mean?
My children were up here and I didn't have the little sheet of paper with the symbols on them, and the concierge gave something and they didn't work, and you know, Gone with the Wind and hi-ho, or whatever, something that would be better than.
Something you can remember. I mean, that's a question for Ho and for IT. You can understand why having complex passwords is important,
I know, but
but it makes everybody's life more complex. I hear you.
this is sort of like the physics instructor that didn't want to use letters, he wanted to use numbers, so a Q became a 4, you know.
Right.
It didn't work.
Yeah, it's not a cipher, but it's common practice in the IT world and even in everyday world. My sister-in-law uses a very long, complex password that nobody would ever guess that she has to write down. So it's just the way of the world right now. It has to be more complex to prevent cyber issues. I hear what you're saying, though. Sure, you always do.
If you had a password manager built into your device, whatever device we're talking about, phone, tablet, computer, it remembers all the passwords. You only have to remember one. And it will automatically fill in for you, and you don't have to remember passwords or write them down ever. I can recommend a couple of free ones if you need them, but they work really well.
Yep, good recommendation. Thank you. All right, friends. Well, enjoy the rest of your time. Enjoy the rest of the coffee out there and the treats, and we'll see you around the campus. Have a great day.